It's certainly been busier in the last year, and I think people are feeling that, but we've got a way of overcoming that and just keeping on going. I enjoy working with the people that are here in ED. They're mostly a barrel of laughs. That's why I come here. It's absolutely vital to have a sense of humour. It's how we cope.
Past 12 months have been busier. Of course, we're getting busier and busier, and I think from an education perspective, that has its positives, that there's plenty of, content and opportunities for us to learn. We work really well as a team together, and I think having that opportunity to learn from each other, whether it be social, clinical, you kind of depend on each other.
The ED machine is a very busy ED machine, but I love doing what I do here as the clerk. Every day is different, but it's always busy. Everyone that works here has a role to do. Some days are crazy, but in that crazy times, there's always, a laugh somewhere along the line.
There's a sense of pride about being an emergency nurse. Even myself, I wouldn't say I'm an emergency nurse unit manager. I'll always go and say I'm an emergency nurse, because I think that the community really respect that. You help so many people. You see them at their worst, and you get to assist them through some of those times. And really, I just think that they all do an awesome job. I think that there's such a good spirit amongst this team. They all look out for each other. They're friends. They've got the patient's best interest at heart.
There's a lot of hustle and bustle, but everyone sticks together, gets everything done. And the domestics and housekeeping just try and, fulfill what the nurses need and the doctors need for us to help them along the way. I feel very proud of everyone. The nurses and doctors and all the staff here are just wonderful. They've made it feel really comfortable.
1 minute I could be making beds, cleaning trolleys. The next thing I could be doing my role as part of a multi-trauma. We handle stress in different ways, but the most thing is everybody likes working down here, so there's always someone to talk to. There's always another avenue you can go down to relieve your stress, to talk things out.
Working as part of the team in the Emergency Department is a real pleasure for us. We get to interact with paramedics who bring patients to us, as well as families and their carers. We then rely wholly on our medical, nursing, physio, allied health, PSAs, and all the members of the other staff who are involved, our reception staff and clerical staff, which makes the Barwon Health Emergency team a real pleasure to work with. Over the last year, we've seen around 72,000 annual presentations, which is a significant increase on the last couple of years. And that's hopefully because not only are we the safety net for the community, but they're providing increasingly good care. We don't know what's going to happen one day to the next. We have a rough idea of how many patients will come through the door, but that's been increasing month on month over the last couple of months. We see more and more children and families, and the complexity of cases is always increasing. But with the team that we have here, with the engagement, with the knowledge and the skill set, we're hoping to provide excellence.